My name is Angie Katarski, and I am the Community Resource Navigator for the IDF. And a SCID mom of a young adult, I want to add. Today, I want to introduce Dr. Patel. She is going to be presenting on parents of children with SCID and CID and complex PI and how to empower them to become their own advocates. We have 45 minutes allotted for this session, and we'll be keeping to that time frame in order to keep the conference running on schedule. If time permits, I think Dr. Patel is going to ask questions to you guys to kind of make this more of a discussion during her talk. We want to thank our very generous sponsor for their support of our educational program and community services. This session is supported by KSC. The information presented during this session is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with questions concerning a medical condition. The Immune Deficiency Foundation education events offer a wide array of educational presentations, including presentations developed by healthcare and life management professionals invited to serve as presenters. The views and opinions expressed by guest speakers do not necessarily reflect the views and opinions of IDF. Dr. Priya Patel is the Assistant Professor of Medicine at Children's Hospital of Philadelphia and the University of Pennsylvania Allergy and Immunology Division. She has a transition clinic at CHOP and Penn State, I guess it would be, right? UPenn, sorry. It's probably a big deal, right? At UPenn, yes, sorry, to help transition pediatric atopic and immunodeficiency patients to adult care. So thank you, Dr. Patel, for being here, and welcome.
Can you all hear me? Okay, great. Oh, I'm so glad, I'm so grateful to be here. I'm so happy to be here to talk about a topic that I feel very passionate about, which is the transition of care from pediatric to adulthood. I've had the opportunity to meet some of you and some caregivers of young adults, and I've been really, I think, impressed, and I just want to say you all are amazing. You've been wonderful advocates for your child so far, and I think shifting into kind of empowering your child to become their own advocate can sometimes be challenging. So I hope that through my talk we can kind of go through how we can make that happen. I have no disclosures, and these are the objectives for today. So we'll talk about how to include children, we'll talk about developmentally appropriate examples of how to include your child in knowing their medical knowledge and care. We'll talk about the importance of early and consistent documentation and communication in supporting your child's ongoing continuum of care. We'll talk about how the transition of care timeline should start way before age 18, and I'll go through some vital resources that could be helpful for those of you who may not have a transition program at your local center. So looking back, if you were to reflect, if you think about your child's first words, first steps, first time you dropped them off to daycare, first time you dropped them off to school, first day of high school, all of these transition periods can be very happy and hopeful, but at the same time can also be very stressful and nerve-wracking. And similarly, when you think about transitioning to an adult provider, this may elicit similar types of emotions. It could be a very exciting time period, but at the same time, it can be very challenging and stressful and nerve-wracking. So today, I'm going to talk about these things broadly. So we'll talk about inborn errors of immunity and some issues specifically that are faced during adolescence and young adulthood. There's a definition of transition of care. We'll just briefly talk about that. We'll talk about pediatric and adult models of care and how they differ. I want to hear about you all, about your experiences and some barriers that you may have experienced while thinking about transition or officially transitioning your child. We'll talk about a transition timeline. I'll go through some transition readiness assessment questionnaires that are out there. We'll talk about how we can utilize technology to help us in this transition process. We'll go through how we can improve some barriers of care. There are certainly many areas for improvement, and I definitely want to hear from you all. And then we'll go through some helpful resources. So to start, specifically, adolescence is a very vulnerable time period, and then you pair that with a chronic condition and an inborn error of immunity, and it becomes an even more challenging, vulnerable time period. For some young adults who have certain complex PI, SCID, or other inborn errors of immunity, you're susceptible to very severe infections, autoimmunity, and other conditions as well. Your PI may be affecting many different organ systems, and so your child is probably seeing multiple different subspecialists, not just the immunologist. Your child may have gone through some intensive therapies in the past, including potentially a transplant in the past, or maybe gene therapy requiring long-term monitoring. Your child may be on chronic therapies, prophylactic antibiotics, prophylactic antifungal medications, immunoglobulin replacement therapy, immunosuppressants, biologics, again, requiring long-term monitoring. And then adolescence itself, it's a challenging time period. You're going through different transitions. Maybe your child is moving to a new location because of school, or maybe there's a career transition. There may be other issues, comorbid mental health conditions, reproductive health issues. So there's a lot of different things that are going on during adolescence. And the brain is biologically actually still developing. So if you can look, like, all the blue areas are mature areas, but you can see like the last area of the brain to develop during adolescence is actually the prefrontal cortex, which is involved in executive functioning. So all of this is going on, and at this time, your provider may be saying, well, your child's 18, maybe it's time to think about transition. So it's there's a lot going on during this time period. So how can we make this as smooth as possible? So transition of care, the official definition of transition care is a purposeful, planned process that addresses the medical, psychosocial, and education vocational needs of adolescents and young adults with chronic physical and medical conditions as they move from a child-centered to an adult-oriented healthcare system. And I put purposeful and planned process in red because it's not something that happens overnight. This happens over many years, and it's a plan that you make with your healthcare provider to kind of plan this to be as smooth as possible. So just to kind of talk about the different models of care. In the pediatric model of care, oftentimes the caregivers are in charge, and the care is monitored by the parents and healthcare providers. There's often more support services available at the pediatric center compared to the adult center. You've probably noticed that. Obviously, the transportation is provided by parents, and the insurance is provided by parents. But in an adult model of care, everything is more self-directed. The care is self-monitored and supported by healthcare providers. On the adult side, you often have to kind of seek your own support services. You have to provide your own transportation, provide your insurance. And like I said, there's many other transitions occurring at the same time. And then your role as a caregiver will probably change as well. So, as your child was growing up, you were the provider of their care, but the goal is kind of to empower your youth to become the leader of their care. So you can see the role of the provider changes from a provider to a consultant, and the role of the youth changes from the receiver to the leader of care. So here I wanted to pause and hear about your experiences. I wanted to, kind of just hear, have you thought about transition? What prompted discussion about transition with your providers? Is there a transition program where you're all at? And what are some of your concerns and barriers to transition? So I'd love to hear about your experiences, however much you want to share about this process.
So, as I stated in the last session, my son was transplanted out of state, and the facility that he still follows up at, he's 23 now, does have a transition center that he now, instead of going into the pediatric clinic, he goes to that side
Right.
of the clinic, but it's still the same physicians that he is seeing when he's there. What has been a little bit more difficult is finding physicians for the other issues, like he still has chronic sinus infection, so finding an ENT that also kind of understands maybe the immunology side. And we found that much easier when he was in pediatrics and much more difficult now that he's transitioned to adult care, where the old local pediatric facilities we used to go to say, you can no longer come here because you turned 18. You got to find help elsewhere. But not many adult physicians understand SCID and sort of the complexities of his condition. So that's been a little bit more challenging. And I don't feel like maybe we haven't asked the right questions. Maybe it's on us from his transplant doctor, but there hasn't been a lot of assistance in coordinating that care to local providers that are within other specialties.
Yeah. Have you found that some subspecialists have wanted to transition sooner than other subspecialists? Like I can just kind of say, like at our center, sometimes the pediatric immunologist will continue to see the patient for a while, but then, you know, ENT may be like, oh, you're 18, and so it's time to transition.
Yeah. We actually had, so my son was, when he was 17, he was hospitalized for some GI issues, and we saw a gastroenterologist when he was in the hospital. When he turned 18, some of those issues were flaring back up again, and so we reached out to that same doctor we had seen 4 months ago in the hospital, and their office called me back and said, unfortunately, now you're 18, we can't see you. And so that was sort of a shock. Like, we just saw you 4 months ago. What do you mean? Like, a birthday happened and we can't see you anymore. So, but you're right. His immunologist said, I will see him for life. Like, he wants to continue to follow him.
Yeah. I mean, as like allergy immunology as a whole, like the fellowship program, like you're trained in pediatrics and adulthood. And so, you know, I think we're kind of dual trained in a way. So that may be a reason why the pediatric immunologist is continuing to see the patient into adulthood.
We had issues with, we signed up for proxy access when he turned 12.
Yep.
And at one institution, we could see his labs.
Yeah.
At the other institution where we do his labs, where I had proxy access, we can't see them.
Yeah.
And then when we tried to set up an account for him, it was a nightmare. So just a barrier of care. And then asking to be like called about his labs, they wouldn't even call me. So it was kind of a learning
It's interesting that
experience.
happened at age 12.
Yeah, 12 in Minnesota,
Okay.
age 12.
Okay.
Can you maybe go over why such a young age, I think for us it was 13, why the pediatric patients are being asked to provide their approval for parents to get information?
I wish I knew why I was so young. I don't know.
It's because of girls and birth control.
Okay.
I mean, in Minnesota, that's the primary reason anyway.
So I think in the last couple meetings have been very helpful to think about, so my child is 14, and her original transplant institute were still very involved with, you know, a lot of things going on still, and I think that they actually see patients to 35, I believe, so which is great that we could continue that, but living in Northern Virginia, going to another state is, you know, eventually is difficult, not enough time, and then eventually is college and wherever that is. But I think just thinking about the last couple meetings that I've been in, and maybe this is a suggestion for IDF, is a way to almost have a template, something that we can put all of her files into. And I think some of the struggle has been like my chart, you know, you'll have a very a health system specific my chart.
Yeah.
But I can't connect that to my other my chart for her pediatrician and then the other my chart for somebody else, even though it's all my chart. So it would be nice to, from an IDF standpoint, maybe to help, you know, some sort of platform. I mean, there was some great forums that I was going through on, like, you know, for advocacy day to how to explain what your child has to someone and boil it down.
Yeah.
But I think as someone transitions is, how does this, maybe that 18-year-old when they go to the physician at college, explain what they have going on very easily.
Yeah.
And so something like that, I think, would be like a transportable electronic medical record would be fantastic, I think.
So, and later on in my talk, I'll talk about how it's important to have a medical summary, and I will put maybe like, I think my presentation will be available for you all afterwards, but on the medical summary is just like really just kind of important things to put on there for the adult providers, such as like the date of the transplant, the type of conditioning, the types of, if there were any sort of complications, those kinds of things are all important information for the adult immunologist to know. So I'll mention all of that in a couple of slides, but that's really important, like one-page document that you can, your child can just keep on their phone or just kind of have a picture of it that they can give to all of their adult subspecialists.
I think too, it'll be bigger than a one page.
Yeah. But like condensed.
Honestly, technology-wise, that's been a difficulty. IDF had its electronic health records at one point, and it had so much trouble being able to connect to the different formats, and everybody would finally get connected to one, and it would change to another. It became so expensive to keep adding modules and things to get into it that it wasn't sustainable. The technology was changing too fast, and every time somebody's technology changed, they had to buy a new platform, and it was extremely expensive to be able to tap into those platforms. It just wasn't sustainable, unfortunately, the way records are. And like, I know like in Northern Virginia, almost everybody's on Epic. They don't talk to each other. They're all Epic, but the Epics don't talk to each other.
Yeah.
It's terrible. One of the things I was going to mention is I've talked to a few people who say, oh, well, my immunologist will see my child until they're 24, 35, whatever age. So they feel very secure. And I say, but does that doctor have privileges at the hospital you would go to if they were hospitalized? And they just look at me and go, oh, no.
Right.
And it doesn't cross their mind that if there's an emergency, they're going to be at a hospital where nobody has a clue.
Yeah. Yeah, I can keep going, and then I will definitely answer questions as I'm going. So thank you for sharing that. I think, we're still, like, I have a transition clinic, and I just feel like it's grown throughout the years based off of the experiences that I've had and based off of feedback from my families. So these are some reported barriers for specifically youth, young adults, and caregivers, just kind of fear moving to a new healthcare system. Relinquishing control. We have a great set of immunology nurses over at the Children's Hospital, and they kind of become like part of the family for some of our patients, and then kind of moving to a new set of, staff, a new nursing system, all of that can be scary. New logistics, parking, just new buildings, things like that. Inadequate planning, inadequate support from clinicians and healthcare systems. And then, maybe the youth and young adults may be more interested in other aspects other than their health. Maybe they're focusing on careers. And so those, another kind of reported barrier. And then system difficulties, just as you had mentioned, lack of coordination and transfer of medical records, inability to access records from the pediatric center, loss of insurance coverage after a certain age. Someone else mentioned difficulty in locating an adult provider with specific knowledge about SCID or specific knowledge about a complex immune condition. These are all some reported barriers from the families. So specifically, some transition challenges in adolescence with inborn errors of immunity have been, with increasing independence, there could be maybe some forgetfulness in taking some medications, leading to maybe some more frequent infections. And we do know that there's emerging and worsening depression and anxiety during this time period. There may be some financial independence for our adolescents and young adults as they're learning to navigate through everything. And then, as I had mentioned, there's multiple subspecialists involved, and the transition time periods for those subspecialists may be different for the transition time period for the immunologist. What are some specific transition challenges for caregivers of those with inborn errors of immunity and complex PI? Caregivers have mentioned financial barriers related to sustainability of treatment courses as the children age. logistic and support issues related to transition, specifically, like the health access to health care for their child. Absenteeism from work because caregivers may be, going to their child's doctor's appointments or hospitalizations. Reduced insurance coverage as their child reaches adulthood. And then what about challenges for providers on our end? So there was a survey that was administered through the Quad AI and CIS for all Quad AI and CIS members. And a quarter of those who answered that survey reported that they did not have a transition of care policy. About 18% had an informal policy. Only a quarter were satisfied with their current practices. And about 44% agreed that a consensus statement would be helpful. So there is currently no kind of consensus statement on transition for immune deficiencies. There may be some fragmentation of adult services. There may be lack of adult subspecialists, as was mentioned, lack of time and resources. Sometimes for us on the provider end, we get a certain time period to see patients, and during that time period, it's hard to kind of prepare all the resources needed for transition. But that's why transition clinic can become important. And then, as I had mentioned, lack of national and international consensus guidelines for transition of primary immune deficiency patients. And this is something that we can work on as a team, maybe with the help of IDF and just kind of, advocacy and kind of getting a transition policy out there. But structured transition is important because lack of structured transition can lead to poor medical adherence, poor discontinuity of care, poor patient satisfaction, higher healthcare utilization, including ED visits and hospitalizations, and higher cost of care. And when is the right time for transition? It does not need to happen at 18 years. There is no specific age cutoff. It's really an individualized, staged, and gradual approach, and transition actually starts at age 12. So I'm going to go through kind of the 6 steps of transition, which starts at age 12. But the transition process is determined by your child's psychosocial maturity and readiness, and the age does not correspond to when you need to transition. And factor in the whole family's preferences. I include siblings in this because they have a role to play here as well. So this is the 6 stages of transition. This was through gottransition.org. So if you haven't already looked at this website, gottransition.org, it is amazing. So I'm going to mention a few times through my talk. They have a lot of resources for caregivers. They have a lot of resources for patients and a lot of resources for us as providers too. The first step is establishing a transition policy. So some healthcare centers actually do have a transition policy. So you can ask your healthcare provider if they have a transition policy. And this should start early, around ages 12 to 14. From 14 to 18 years, this is when we're tracking progress, assessing skills. So this is where we kind of use the readiness assessment questionnaires, and I'm going to show you what those look like. And then we're also establishing a healthcare transition plan. So in my transition clinic, I have kind of like a healthcare transition plan with my patients, and I have goals for the next visit. So I say the goal for our next visit is to get to learn to know what your medications exactly do for you. And then at this time, we also sort of kind of make a medical summary. And then around 18 to 21 years is when we start thinking of transferring to an adult-centered care. And then afterwards, we have to confirm that the transfer is completed. So this is kind of another slide of how the roles can change through this whole process. So the early transition years are ages 10 to 12 years. The parent, you all, are the manager of the healthcare task, and right now you're providing your child with supervised autonomy. It's important for your child at this age to know what their PID diagnosis is and what that means for them. I have SCID, and this means that I am more susceptible to infections, including severe infections, and I need to be on my immunoglobulin therapy and my antibacterial medications to prevent me from getting very sick. So kind of having a one-liner of knowing your PID diagnosis and explaining it to others. Knowing important symptoms as well. Knowing sort of the types of medications they're on. At this point, the caregiver can kind of help prepare pill boxes, or sort of have like a medical card for the medications, and the caregiver can help with adherence. And then from 13 to 16 years of age, these are kind of like adolescent-focused care. So here we have more autonomy with support. And important here to kind of know a little bit more about the disease, kind of focus on adherence with their medications, kind of healthcare, healthy lifestyle. We can talk a little bit about college and vocational planning. And then afterwards, 18 to 25 years is kind of when there's autonomy with or without support. So at this point, the child should be able to kind of refill their own prescriptions, go to their own clinic appointments, kind of talk about, understand what their insurance covers, and maybe kind of figure out career planning at this time too. So here are kind of the different stages and what we can think about at each stage. So at ages 12 to 13 years, help your child learn about their immune condition, medications, and allergies. Really encourage your child to ask doctors questions, like have them write down in their note section on their phone just some questions. And these questions often happen not during the appointment. The questions may happen when you're at home. So write it down and then bring it to your bring it to the doctor's appointment. At this point, it's also good to ask the immunologist if there is a transition policy. I know it seems like it's so early, but it'll help you as a caregiver kind of have a plan in mind for what to do as your child ages. At 14 to 15 years of age, think about taking some readiness assessment questionnaires, and I'll show you examples of those. Have your child carry their own insurance card. Help your child learn about their health and specifically what to do for emergencies. And help your child make their own doctor's appointments and refill their prescriptions. And if you can, have your child see the doctor alone for part of the visit. This will help the doctor kind of bring up some sensitive topics, including, maybe some, concerns for mental health or behavioral issues or, just questions about substance abuse. So these are some readiness assessment questionnaires. It's called a TRAC, Transition Readiness Assessment Questionnaire. It's a validated questionnaire. I give my patients this TRAC in my transition clinic just to kind of get an idea for what are the areas that we need to work on. So there's kind of different areas: managing medications, appointment keeping, tracking healthcare issues, talking with providers, and managing daily activities. And then the different prompts are like, no, I don't know how to do this. No, but I want to learn. No, but I'm learning to do this. Yes, I've started doing this. Or yes, I always do this when I need to. I know in my patients the lowest scoring areas have really been around the questions of healthcare insurance, like knowing what my healthcare insurance covers. Like question 10 and question 9 and question 10 have been the lowest scoring areas. I think it's just because, I think insurance is confusing. And there was a session, I'm so glad that the IDF had a session here just on understanding insurance, because it's really confusing. Even as a healthcare provider, it can be very confusing. These are readiness questionnaires specifically for patients and caregivers, and these are available at the gottransition.org website. So this is kind of for the parent to know, what does my child need to sort of work on. And then there's also a readiness questionnaire for youth with intellectual and developmental disabilities. Again, all of this is available on gottransition.org. So these are some questionnaires that you can kind of start doing between the ages of 12 to 14 years to help you understand what areas do I need to work on. All right, so then we get to ages 16 to 17. So here we go, ask your child to kind of make their own appointments, ask doctors questions, and get refills. Here's when we should start making a medical summary, and I'll kind of show you an example of what that looks like. Age 18, there's this cutoff, after 18 years, you're not gonna have access to your child's medical information unless they agree. So there are some, you'd have to sign a HIPAA access form, and you can be your child's medical power of attorney. So in the case of an emergency, you will be kind of the contact person. So make sure you figure all this out before 18 years of age, because otherwise it's all of a sudden there's a birthday involved and then things changed around, things shift. Also learn if there are additional changes after 18 years, including with healthcare insurance. At this point, you can ask your immunologist if there is an adult immunologist that they would want to refer to in the future. And then have your child keep a copy of their medical summary, either on their phone or in a binder or a folder somewhere, easily accessible. And then kind of later on at 22 to 25 years of age, is encourage your young adult to get care from their adult doctor now, learn to manage their own health, update their medical summary. and know what their insurance covers. So these are some questions you can ask your child's doctor about transitioning during the adolescent years. How can I best prepare my child to meet with you alone? What does my child need to get ready for adult health care? How can we prepare a medical summary? What information about privacy and consent do I need to know before my child turns 18? And then before transferring to a new adult doctor, is there an adult immunologist that you recommend? Will my medical summary be sent there? Will you be communicating with them? It's very important for the pediatric and adult immunologist to communicate. And a lot of times, like especially for like complex PI, SCID patients, your pediatric immunologist may have sent other previous SCID patients or post-transplant patients to a specific adult immunologist. So just kind of important to know who would be a good adult immunologist to connect with. And then this is the medical summary. So if there's one thing that I would say is the most important part of my talk, it is this. It is knowing what should be included in the medical summary. So for under history, it's important to know what are the previous treatments, previous medications that were trialed, and what were the diagnostic imaging results. So specifically, what previous immunoglobulin products were tried, if there were complications, what were the complications, what immunomodulatory therapies were tried, were there steroids, were there GVHD medications, biologics, what were the results of imaging, if your child went through a bone marrow transplant, what was the transplant date, what was the source of the transplant, what type of conditioning, very important, what type of conditioning was used, was chemotherapy involved, was radiation involved, what were the complications. If there were previous hospitalizations, what were they and what kind of came out of it, what kind of infections were involved. And this is something that your doctor should help you prepare, like as a team. What is the current state? What are the pertinent physical exam findings? Is there a skin rash? What are the current medications, including the immunoglobulin product, the dose, the frequency, infusion log? What's your antibiotic regimen? What are the frequency of visits? Is your immunologist seeing you every 6 months, every 1 year? Who are the other subspecialists involved? And then what other ancillary services do we have in place? Is there a learning disabilities assessment and support team that's involved? Most importantly, what's our action plan? What's the action plan for the emergency room? What's our action plan for the inpatient stay? And then finally, what are our future steps? So this is something that I think is very important to keep with you. If the adult immunologist does not have access to the pediatric immunologist records, this is something that I think would be very helpful to the adult immunologist. And then utilize technology. I spoke with a couple of people about this. So set up the medical ID on your phones. If you have an iPhone, use the Health app, select medical ID, write down all the medical conditions on there, including medications and allergies. And then most importantly, put on there, under emergency access, select show when locked, so that if something were to happen to your child and the phone cannot be unlocked, at least someone else will be able to access the emergency contacts and the medical information on the phone. There is, on Androids, there is a free medical in case of emergency contacts app, and so you can do similar things on that app, and then you can, under settings, say tap on lock screen, so that again, all of this information is available on the home screen if the phone is locked. I know, someone had mentioned that one of the barriers is that the healthcare systems are not connected. Things thankfully have improved over the last few years, and that we have care everywhere where we can see many different healthcare systems. The CHOP and PEN networks are interconnected, so we're able to see those medical records, but there's still a lot of work that needs to be done in this area. So how can we improve specific barriers to transition in terms of, youth being unprepared to manage their own health? I think if we kind of strive to have some visits alone for patients with the caregiver, it can help increase autonomy, increase confidence. It will give the chance to ask about sensitive topics. Utilize the transition readiness assessment questionnaires. And then in terms of inconsistent approach to transition, if we follow these 6 core elements to transition, it will help have like a more formalized approach to transition. I think an important thing is incorporating this transition education into medical education so that, residents, fellows, attending physicians are able to follow the same 6 core steps to transition. And then generate a medical summary to provide to adult providers to help prevent poor coordination of medical care. So my last slide are these transition do's and don'ts. So do talk to your immunologist early about the transition process. Like I said, it starts at age 12. Encourage your child to make their own appointments, ask doctors questions and get refills. Talk to your immunologist about creating a medical summary together. Learn about what privacy and consent changes occur after 18 years of age and what you have to do before 18 years to help you get some access to some records if you needed that. And learn about health insurance coverage and changes as your child ages. And then talk to your immunologist about referring to and communicating with an adult immunologist. Don't transition just based off of an age cutoff. Also, don't transition when there's any sort of acute treatment happening. Transition is best done when everything is stable, or as stable as can be, and when things are at baseline. So here are some helpful resources. Like I said, gottransition.org is wonderful. The readiness assessment questionnaires are there. There's also a sample plan of care. There is a sample medical summary on there too. It's not specific for PIs, but it's kind of a more broad medical summary. There's a sample transfer of care checklist. The immune deficiency has actually, the IDF actually has a transition guide. So that has been really helpful. We just edited that, I think, 2 years ago. And then Family Voices is great too. This is a transition resource for youth with special healthcare needs or disabilities. The PACER National Parent Center on Transition and Employment is also great, specifically for kind of communicating with supervisors or with college professors about their diagnosis and sort of accommodations that may need to be made. And then specifically CHOP has some like patient family education handouts, and you can see if your local hospital has similar patient family education handouts. And then the AAP, Society of Adolescent Health and Medicine, also has some wonderful resources. So with that, I wanted to say thank you specifically to my rockstar patients and their families who've taught me so much, and thank you to you all for sharing your stories. I think there's again growth that needs to happen, and with all of your help, I think we can kind of help the transition programs grow throughout the country. So thank you.